In a moment, my partner, Dr. Virginia Caine, will be, well, she's already on, but she'll be capable of giving her review, her regular review of the COVID-19 data. Thankfully, trends continue to head in a good direction, the right direction. Accordingly, the Marion County Department of Public Health has determined that we can safely increase capacity limits and adjust the current curfew. So let me just briefly review those changes that will be effective Monday, March 1. Bar capacity will increase to 50% with bar seating as long as social distancing is followed. And that is an increase that's up from 25% capacity. So bar capacity for bar seating will increase to 50%, but we encourage all proprietors, all restaurant owners, all tavern and bar owners to make sure that social distancing is in fact enforced. Indoor restaurant capacity will increase to 75%, up from 50%, with, again, continued social distancing protocols in place. Thirdly, the curfew for bars, restaurants, and music venues will move to 2 a.m., back from midnight. And that is a significant change that we want to make you aware of to be made effective March 1, next Monday. Gym and music venue capacity will increase to 50% from the current level of 25%. And so with those announcements, I'm going to leave it to Dr. Caine to dive into the data that makes these adjustments possible. But I want to be clear. We remain together as vigilant as ever. And this change does not diminish our desire to avoid an increase in positivity rates before, during, and after the NCAA, upcoming NCAA men's Division I basketball tournament. We also are committed to being responsive to trends in this data, and our health officials have determined that we can safely make these adjustments. This morning's update also includes the introduction of a new community-oriented call to action. Dr. Caine, with my full support, has set a goal to vaccinate 80% of our Marion County population against COVID-19. Now, this number conforms to what many health experts say is a primary precondition for returning to a pre-pandemic lifestyle. But for us to achieve this level of immunity, the city is going to need your help. It is for this reason that the city's Office of Public Health and Safety has partnered with the Marion County Department of Public Health to create the COVID Community Ambassadors program. This will be a neighborhood level campaign to spread awareness of and trust in the COVID vaccine. We are especially focused on the most vulnerable residents, excuse me, in our city. Becoming a COVID community ambassador is simple. Just sign up at indy.gov/COVID. That's indy.gov/COVID. And you will receive updates on eligibility, vaccine locations, and more. When signing up, participants will take a pledge to get involved. That can include helping others sign up to get their shot, shuttling a homebound neighbor to their appointment, or simply posting reliable, fact-based information on social media for friends and families. For some, a loved one with firsthand experience can be what finally spurs a friend or neighbor to set up an appointment. For that reason, I want to encourage every resident to do their part to make sure that nobody is left behind. To kick off the COVID Community Ambassador campaign, the City of Indianapolis and the Marion County Department of Public Health will host 2 webinars for participants on Facebook Live. One will be in English, and it will take place on March 3rd at 6 p.m. The other webinar will be in Spanish, and that will take place on March 4th at 6 p.m. Again, for more information about these 2 webinars of our COVID Community Ambassador Program, more info is available at indy.gov/COVID. So the English webinar, March 3rd at 6 p.m., the Spanish webinar on March 4 at 6 p.m. And so with that, I'll hand it over to my partner, Dr. Virginia Caine. Doctor?
Say that we have just made some extraordinary gains with our COVID-19 efforts. And I just have to thank all of us in our community who've just made extraordinary efforts to practice safe infection control, such as washing your hands, social distancing, and wearing masks. And it is highlighted in the remarkable responses and data that I'm going to show you in the next few minutes. First slide. So, again, I will reemphasize that there are 2 criteria that we primarily use in order to say how well we are faring in our progress in this COVID-19 epidemic. One is based on our positivity rate. And what we have said is that we're doing extremely well if we're less than a 5% positivity rate for at least a minimum of 2 to 3 weeks, followed by the daily number of daily cases we are experiencing. Back in late Thanksgiving, December, we were experiencing a 16.4% positivity rate. I am happy to say through February the 16th, we have reached down to 3.8% positivity rate. 3.8% positivity. And you can see how we drastically started going down just in mid-January, making substantial progress. Next slide. Now, the other major criteria that we used, there are 2: positivity and the number of daily cases per day. Our goal for that is no more than 35 cases per day, and we're getting close. So that in December, we were experiencing for 2 days in December, we had over 1,000 cases reported in a day, followed by daily cases of over 900 and in the 800s. So we have gradually, significantly got down to 109 cases. But I do want to emphasize, we are still high in this category. Whereas we're doing great in the positivity rate, we're still high with even 109. And we need to see that number drop to 35 cases or less for a minimum period of 2 weeks or 3 weeks. It kind of varies. So that even if we had an influx of cases that come in, it would be a slower spread of less numbers if we can reach those two criteria. So fantastic with the positivity rates, still high for the cases, but making remarkable progress. Next slide. Our ED visits have been remarkable in that they have come down substantially in terms of patients who are actually experiencing COVID-19 symptoms. And you can see here, we're only having nearly 14 people per day complaining about ED visits with COVID-19 symptoms. I can remember when those was in the hundreds, but look, the remarkable progress we're making. Next slide. And as such, with less people going into the emergency room for symptoms, it's no surprise that we have sort of plateaued now in terms of the number of people being admitted to our hospitals with COVID-19. So you see that we're somewhere around about, maybe 6 to 8 cases being admitted per day, which is just unheard of, remarkable in our progress. When we were experiencing 35 cases per day, we have dropped substantially down to just anywhere from 5 to 7 cases per day. Next slide. The even best news, the better news is we are seeing a substantial decline in our deaths. And so we're now having no more than 1 to 2 deaths per day. And that's been our goal. And this highlights we've had some great strategy in terms of the interventions we put in place, and very difficult, I think, from how do you balance infection control from the economy. But we obviously, from an infection control standpoint, are making significant gains. Next slide. So how do we fare compared to the other counties, surrounding counties? You will see that all of us started with a remarkable number of cases. And of the cases, both Marion and Johnson are the lowest new cases occurring per 100,000 residents. So we're the lowest at no more than 11 cases per 100,000 population. And Johnson County is no longer having substantially less cases with 11 cases per 100,000. If we looked at Hamilton, they're experiencing 15 more new cases per 100,000 population. Hancock and Boone are our next counties that have stepped up to like 12 cases per 100,000. But all of us, all of the counties are showing a decrease, but Marion and Johnson may be showing the lowest so far. Next slide. Now, when we also look at our age distribution of confirmed COVID-19 cases, we're holding steady for our senior population, 60 and older. So it's making a huge difference that they only make up 16% of the cases. And we may be starting to see some benefit from our vaccinations of the 80 and older, our 70 and older, and now this week finally down to our 60 and older. So that may partially be contributing for us staying stable for our senior population. The next highest group are 40 to 59-year-olds, and that's very stable since practically since September, for the last 4 months. Again, our largest percentage of cases are occurring in our 20 to 29 years of age, with about 37% of the cases. We have seen a bump up in our less than 20-year-old cases. We're up to 19%. We're going to have to monitor that very closely. But it appears as though 75 to 80% of those cases are mainly in our 18 and 19-year-olds of that group, less than 20%. Next slide. So I know the slide's a little busy, but what it highlights is that all of our age groups are seeing a decline in the cases. If you look at the lavender, okay, you will see that they're experiencing less than 25 cases per day. The ones in the lavender, less than the 5-year-olds, and actually they're less than 5 cases per day for the lavender cases. If you look at our elementary, they also appear to have less than 5 cases per day. And then our next group, our middle school group, which is in that green, it's the third line, also are substantially low, with less than 10 cases per day. And then our next group happens to be in the gold, our high school students, and even they are faring well and looking at about almost 10 cases per day, or 10 to 12 cases per day. And finally, our group who have the largest number of cases are adults over the age of 18, but all 3 groups are showing substantially less than 12 new cases per 100,000 residents. Next slide. And this is just maybe shows you a little bit better that if we wanted to look at the particular number of cases, who's got the highest cases per 100,000 population, it looks like our college age group between the ages of 18 to 24. They have the largest number of cases in the blue. And as you can see, closer to February, the end of January, they were the highest, but still a considerably very low number of new cases per 100,000 population. With our next group, our adults, 25 to 64, followed by our groups of our schools from K to 12. You can see the K through 12 and less than 5 years of age are appearing to be our very safest group from community spread, because both of them, the green and the lavender, they are all less than 10 cases, showing very minimum transmission spread for COVID-19 in our schools. Next slide. So as a result, just as Mayor Hogsett has stated, effective March the 1st, we are going to increase our restaurant capacity up to 75%. Our bar capacity will be increased to 50% with bar seating, but you ask that you social distance between the bar seating seats. And then our bars, our restaurants, and music venues can now be open until 2 a.m. in the morning. But please, I want to caution you, we don't want to see a substantial increase amount of unsafe activity because of that extension from 12 to 2 a.m. But we've been doing a remarkable job so far, and so that should be able to be continued. And our gym and music venue capacity can increase to 50%. Now, one thing I have not mentioned is we are closely looking at the school systems for our high schools to see if we can bring them back totally. I hope to make that decision by the end of the week, so that those schools that have been hybrid, can they come back in full capacity, reviewing that information and evidence? And so hope to have an answer possibly by tomorrow, whether we can make any substantial lifting of any restrictions in that area. But these are some incredible, I think, significant gains as our numbers continue. We hope in the future to lift more restrictions. And some may not always be mentioned here, but call us if there are any further questions. Thank you.
All right, thanks, Dr. Caine. We'll now move to the question and answer portion. As always, reporters can put their name and outlet in the question and answer box. I will call on you and unmute you, and you'll be able to ask your question. We'll start off with Mickey Shuey of IBJ.
Hi, Dr. Caine, Mayor Hogsett. I have two questions. First, for Mayor Hogsett, how important is the change to restaurant capacity for the NCAA tournament? And then for Dr. Caine, how as we head into the tournament and a month of basketball, do we continue to have lower cases? How do we keep those numbers down as we expect to see more people come into the city?
Well, Mickey, as it relates to the first part of your question, there's no doubt in my mind that having more capacity in our hospitality industry during this very exciting upcoming period in March and April will do, no pun intended, put a shot in the arm of our hospitality industry generally during this period. I want to make it clear, though, that these decisions in no way were driven by March Madness or the basketball tournaments. Those events are wonderful byproducts of a city that has worked very hard to get to a place where public health data and public health experts are confident that we can make these changes safely. And I don't want to step on Dr. Caine's answer to your question, Mickey, but with great opportunity comes great responsibility. And so we're making these changes today because the data and because public health experts upon who I rely have told me the progress that we together have made is making a difference, a substantial difference, which as a byproduct benefits the opportunity to provide visitors to our city or the teams who will be participating, the coaches, the administrative personnel, a safe environment in which to play. But they go hand in hand. So, and again, I'm probably speaking out of turn. This is really Dr. Caine's bailiwick, but we want to encourage all restaurant, bar owners, all aspects of the hospitality industry to take advantage of the reduction in the restrictions that we are authorizing effective next Monday, with the understanding that there is still a significant responsibility that people wear masks when they're not eating or drinking, but they socially distance. And as Dr. Caine mentioned in her remarks, yes, restaurants and bars can stay open now past 12 midnight to 2 a.m. But we want to encourage the ownership of those places to be very, very careful about patrons not abusing the opportunity for these owners and leaders of our hospitality industry to improve their own economic well-being by having greater capacity and greater hours in which to operate. So probably too long of an answer to a pretty short question, but I hope I've covered the substance of what you were asking. Dr. Caine, and I apologize if I've stepped on any of your message.
No, no problem. So you know what? It's a difficult walking act to balance between economics, but the safety of a community. And one of the things that we try to look at based on our experience that we've had in the past. I also talk and have discussions with the health officers of the 32 largest cities to get experience from what's happening with them when they do certain strategies. But I think the most important thing for us is that we've had experience with looking at spectators coming from outside the city, working with our convention center, working with our sports arena, for example, the Indianapolis Colts, working with the Indiana Sports Corp. And we've been able to handle it very successfully and have been able to control our numbers. If I had my biggest concern, it would be spring break and what our own residents do during spring break when they leave our city and go out of state. But I think, and then the NCAA is assisting us so that anybody buying a ticket, they're making sure the education gets to them about our expectations in our city and what needs to be done. So we're putting out a lot of messages out there for any outside folks that may come into our city.
Thanks, Dr. Caine, and thank you, Mayor. Next question is from Eric Berman of WIBC.
Hello, Mr. Mayor. Dr. Caine actually just segued nicely into my question. Isn't March Madness sort of a reverse spring break? Instead of our residents going off all over the country, we're getting not just a large number of people coming to Indy, but a large number of people coming from all over the country, as opposed to just Colts fans coming to Lucas Oil. How much of a concern is that with people whose numbers aren't necessarily as good as ours coming in?
I think that's always a concern, but I'll also tell you, our businesses still are thriving. We're still having people come into our city and meet with some of our other businesses and whatever. So that's been happening all along. I think the other thing that we have to look at is that we, at least with our teams, our players, our coaches, they're in an incredible infection control bubble protocol. I think has not been seen in anywhere close since the NFL bubble that occurred in Florida, where we have even stricter guidelines for our players, our teams, where they're being tested with a PCR testing, almost 14 days before they even start the tournament. They will not be allowed, unfortunately, to get outside that bubble because they're going to be enclosed with the hotels going straight to the convention center and back. But I think about 500 of their parents are going to be there, and they're just as concerned that they don't want to spread infection because they have a special incentive. They want their player to make it to the final, so they're not going to want to do anything that would interfere with that happening and they not being around for that to happen. So I think we just have to continue tremendously with our education. We've put some things in place for, like, if they're here and they get infected, we can easily do our contact tracing. We have over 200 contact tracing individuals contracted to work on this level. We're doing a lot of coordination, not only with IU Health, NCAA, and the Indiana State Department of Health to try to make this the most safest environment that can occur.
If I could, just to follow up Dr. Caine's answer to Eric's question, Throughout the pandemic, we have been guided by the science and the data. That has been our approach from the very beginning. And we rely on Dr. Caine and her team to provide us with data-based decision making. And this time around is no different. So our message is to your question of the possibility that this could be characterized as a reverse spring break. We will stay vigilant. We will stay vigilant throughout this change. And we will continue to trust the health department to follow in its recommendations where the data takes us. I, like Dr. Caine, have reason to believe that the visitors that have been in our city over these last few weeks and months have come in fairly significant numbers, and we have continued to see a reduction in the overall rates that Dr. Caine studies on a daily basis. But that's not to say that we won't remain vigilant, and if the numbers go up, I'm sure Dr. Caine is going to have something to say about that.
Thank you, Mayor. Our next question is from Erica Heron of the Indianapolis Star.
Thank you. Two questions, Dr. Caine. First, on the high school decision, what are you looking at? What are the factors you're weighing about and when making that decision? And then also wanted to ask you about the rapid tests the state has sent to schools. Are you giving Marion County School Districts any advice on if they should be using them or how to use them? And have any of the districts donated them back to the health department?
So, wow, Erica, you just asked me two of the toughest questions. I'm not sure I wanted to address today, but I'll give you my best, okay? I think the thing for all of us is that we're less than our 5% positivity rate, but we're not there yet with our cases. Our cases are really high. So my question is, for our hybrids, the very large classes where you have people in a school and and they can be placed in a school less than 6 feet, is it still safe for having a large number, over 600 students, to be in there, even if they're facing face to face and they're wearing their masks? Can we get away with them being at 3 feet, I believe, what's the governor's order, versus for us right now, we're saying you have to have at least 85% of your students be 6 feet. The rest, 15%, can be 4 feet. So we're trying to look at that number, and I'm trying to talk to my colleagues across the country who may have similar numbers already at 3 feet for all their high schools, and they're able to tell me that they have had no substantial high transmission rate. So I've got calls out looking at that evidence and also having our consultants review the evidence across the country for me. So that's the one point. Now, for the Binex cards. The Binex cards are, I believe from the state who's offered this, have primarily been offering these rapid diagnostic tests because a lot of high schools and schools can't afford to pay and do all of this testing. So I think it's a mechanism because they have a huge supply of the Binex cards that they were able to offer that to a lot of our K through 12 school systems. We do know locally for us at the health department, we're looking at it very carefully because of the sensitivity for picking up a COVID infection is about 66% if you're symptomatic, but it drops down to 36% if you have no symptoms. And so we know that about 40% of Hoosiers can be infected and have no symptoms. So we're in the process of looking at that data to determine whether we feel comfortable about using it in Indianapolis. But we also know we prefer you to have something than not having the ability of doing no testing. And so I think that was the paramount importance from the state of being able to do surveillance testings in our K through 12 grades.
Thank you, Dr. Caine. Oops, sorry. Our next question is going to be from Mary Mills of Channel 13. Mary?
Good morning, Dr. Caine, this is for you. Do you see any chance of the capacity at the venues changing now? I know the NCAA said 25%. Do you see that increasing at all, or perhaps for Big Ten?
I do not see the capacity for the Big Ten to go over 25%. And I do not see the NCAA going over 25%. It'll be up to 25% capacity, but won't be higher, no.
Thanks, Dr. Caine. Our next question is from Troy Washington of WRTV.
Hello. I think this is for you, Mayor Hogsett. I know that you said that it was just a byproduct with the restriction changes and the bars staying open a little later, and it happens to be March Madness when all of this will be going on. But I'm just wondering, what, if anything, are you guys going to be doing to help those local restaurants increase some business during the tournament?
Well, we'll continue to do what we have been doing throughout the pandemic, and that is working with owners and operators throughout the hospitality industry, but particularly in our restaurants, to increase capacity. We had a very robust program last summer and into the fall for increasing capacity for outdoor seating. And with a little bit of milder weather we've been enjoying these last couple of days, I hope that continues throughout the month of March and April. And certainly the city stands ready to do what it can to encourage and assist restaurants, particularly in the downtown area, to utilize outdoor capacity. Obviously, these restrictions being lifted, I hope will have a positive impact on the profitability of those restaurants and businesses during the month of March and April, just simply because of an increase in the amount of customers that they are able to serve. I would say, as a final matter, while I think effectively used the $168 million in the first round of CARES Act that the city received back in March. The fact that the city used all $168 million to help out our residents and our businesses, I would be remiss if I didn't put a plug in, since apparently the United States Congress is, as we speak, considering more COVID-related relief funding. As the chief executive officer of a local unit of government, I certainly want to encourage our congressional representatives to pass as quickly as they can more CARES Act or COVID relief to local units of government and state government, so that we can continue the good work that we were doing across the board. And particularly here in Indianapolis, where our downtown economy is so much dependent on hospitality. And so we will continue to partner with businesses, not only in the downtown area, but really throughout Marion County, to make sure they remain safe and to make sure that they are as successful and as profitable as these restrictions allow them to be. And hopefully with more immunization and vaccines being made available, somewhere down the road, we'll reach that point when Dr. Caine can tell us that we can even be more confident that opening up our restaurants and other places of hospitality can be done safely and effectively.
And if I can take a moment of personal privilege, I'd also encourage people to visit www.indie-eats.com. Visit Indie has worked really hard to create a tool that allows both visitors and residents to see what local restaurants are open, which ones have carryout, which ones have outdoor seating. It's a really nice one-stop shop to be able to understand our local restaurants and to be able to get plugged in with how to support them.
Thanks, Taylor. Our next question is from Tom Healy of Indie Midtown Magazine.
Thank you. Question for Mayor Hogsett, and then if I come back and ask Dr. Caine, I'd appreciate it. Mayor, to follow up on Mary's question, you said the city stands ready to do what it can to encourage and assist restaurants to utilize outdoor capacity. Does that mean the city's going to implement the same sort of street closures in Broad Ripple and Mass Avenue that they did last year?
Look, that's a very good question, and it's one that I would defer to DPW and maybe DMD in terms of the success that we did enjoy last year. A lot of that, of course, is weather dependent. If we were having this conversation a week ago, when we still had probably 8 to 9 inches of snow on the ground and sub-freezing weather temperatures, well, it wouldn't seem as relevant as it does today when we've enjoyed several days of 50 degrees plus. But I would have to defer those questions to the leadership teams, not only the Department of Public Health. I know Paul Babcock is now over at HHC, but back with the Office of Public Health and Safety, he did an outstanding job of working with local restaurants to make sure that capacity was being maximized wherever and however it could safely be maximized. Matt Giffin's on the call now, as is Paul, by the way, but Matt is currently the interim director of the Office of Public Health and Safety, and if Matt has a perspective that he would like to add, I certainly welcome that.
Mayor, if it's okay, do you mind if I jump in?
Yeah, sure.
DPW has actually been in pretty consistent communication with the restaurants and businesses along those corridors, as well as the cultural districts and business organizations that represent those areas. And I think we're attempting to be flexible and have those lines of communication really open for what makes sense for the businesses in the area, how we can utilize our dine out program into the spring and summer months, but also understanding what the restaurants and businesses really want and need from that program.
Thanks, Taylor. Tom, I'll unmute you here in just a sec. Just mindful of the time, everybody. We've got about 15 minutes left and quite a few questions. So if questioners could keep their questions as narrow and succinct as possible, and if our panelists could respond with equal narrowness and succinctness, that we want to be able to ensure we can get to everybody. Tom?
Thank you. My short questions are for Dr. Caine. I didn't see any racial demographic charts, unlike previous of the sessions like this, and the regular updates from your staff show that infection rates are still high for people of color, and I wonder if you could comment on that. Also, part of the science of prevention I'm seeing suggests that ventilation is the key to limiting aerosol dispersion in enclosed areas. Are you recommending increased ventilation, like open windows, fans, et cetera, for schools and bars and restaurants for indoors? Thank you.
So first of all, we're going to be having an update related to the racial breakdown in our cases. We're continuing to see, sorry about that. No, baby, sorry. She's hungry, I think. So we're continuing to see our cases occur. We have a number of significant cases in our Latinx population. We're also seeing an increase in cases in our Burmese population, with a significant decline in our Black and African American populations. But look to hear us give an update related to this probably sometime in the next 10 days, specifically as it relates to that. And then I'm trying to remember what the second question was.
Caine, I'll jump in and take it. It was about ventilation. And Tom, just to really quickly, if you look at the current public health orders, they all recommend as much ventilation and airflow as possible. I think the recommendation is overturning the air in a space 6 times an hour if possible. And so that's been there since day one. And we'll continue to stress that, as well as make that recommendation. And in our larger venues, we've been really hitting that home.
Thanks, Paul. Our next question is from Abdul Hakim Shabazz of Indie Politics.
Yes, Dr. Caine, just a real quick question. Obviously, the restaurant and bar is going to be good news for lots of folks here in Marion County. With respect to bar seating and social distancing, how exactly will that work? Could it be like 2 people who come into a bar next to each other and then social distance, or 3 or 4? But how exactly should bar seating work?
So if you're from the same household, you can actually sit next to each other. But if you're not from the same household, you really need to be at least 3 to 4 feet away from the next individual. So probably I've got a seat here, and then the next seat, no one is sitting there, and then the next seat after that from a bar seating standpoint. But from the same household, you can sit side by side if you feel comfortable knowing if that's the case. Otherwise, they have to have the social distancing.
Thanks, Dr. Caine. Our next question is from Russ Dodge of WITT.
Yes, Dr. Caine and Mr. Mayor. On Monday evening, the City County Council passed a couple of resolutions asking the state to move the teachers and the bus drivers up in the pecking order for the vaccines. What can be done to see that happens? First off, if you support it, and is there some area that the city has some say-so in that?
So let me just say that I'm on the Indiana Vaccine Allocation and Distribution Committee, which there are about 115 experts on these committees from across the state in different areas and different spectrums. So yes, we would really love to push up the teachers as a priority, and yes, Indy bus drivers who are at high risk because they have a lot of exposure from people publicly getting on the bus. And yes, we would like to increase our priority, especially for our air traffic controllers, because, hey, we get our vaccines through the air. We don't get our vaccines from a truck delivery standpoint. And so if we have our air traffic controllers out and I have to close the airport, I pray that nothing is happening similar in our surrounding cities. But at the same caveat, what we are doing is we are having some teachers get vaccinated based on the age group. So any teachers 60 and older are being able to get vaccinated. Also, teachers that provide medical care in their role as medical care, daycare, they are also being able to get vaccinated. We have another proposal before the state. I can't mention it now, as another mechanism where we might be able to get more teachers vaccinated substantially or start the process. And so we're going to wait to hear from that. But I'm very optimistic that the new drug, Johnson & Johnson, will be able to start delivering sometime next week. And if we get a substantial number of vaccines, we can start working on our essential healthcare workers to get vaccinated. And we know in April now, we're promised between Pfizer, Moderna, and the new vaccine, Johnson & Johnson, that we're supposed to have 250 million doses by the end of April. And that means that, it's going to start at the beginning of April. So at the latest, our teachers should be vaccinated increase-wise, possibly by the end of March, but definitely in April, where everyone's been vaccinated. But I do have to emphasize, we're having very low transmission in our schools. I mean, it's probably the safest place to be. And so if I have someone who's 50 years of age, they're undergoing cancer treatment, or it's a sickle cell patient maybe, if they get COVID-19, they're hospitalized. And about 4 times the risk of death, what am I saying? Almost 4 times the risk of death compared to someone who's 20 years of age. They may be a teacher, but they're not going to be hospitalized and they're not going to die. And so these are tough decisions, but we're using a risk stratification process based on hospitalization and dying.
Thanks, Dr. Caine. Oops, sorry. Our next question is from Sherry Rudovsky of The Star, and I think, Paul, we've talked a little bit about this, so you might be able to take this one. Sherry?
Hi, thank you. I was wondering if the travel advisories for people who travel out of states to areas that have higher transmission than ours are still in place to quarantine when people return, and if so, how that factors in to having lots of people come here from different states. And I have another question from I'm sorry, that's all I have right now.
Thanks. So yeah, I will quickly address that. So we constantly look at our travel advisories to see what they need to be updated and why based on the science. And so after this press conference, as we publish our public health order, we're going to review those travel advisories to make sure that they're up to date based on what we're seeing across the country. And so while, the question becomes, how does it, as you said, reconcile with having fans travel here from all over the state? As the mayor said earlier, and as Dr. Caine has stressed as well, and we've constantly been harping on this, wearing a mask and socially distance is the most important thing when it comes to stopping the spread of COVID-19. And so we're going to continue to stress those things during the internment and after, and hope that any of the visitors come will continue to follow those. And we know that our restaurants, our bars, and our venues are going to continue to push that as well. And so we think that our protective and preventative measures we're going to keep us safe, even if we have individuals travel here.
Thank you, Paul. And it looks like we've got one more at the buzzer. Amelia Pack-Harvey from Indy Star.
Hi, yes. My only question is, would the city consider lifting any of these restrictions for bars and restaurants and music venues right before the March Madness tournament, or is this the last kind of update we're going to have before tournament?
So we are lifting the restrictions, and it's going to start March the 1st. March Madness doesn't happen until, I believe, around about the 12th or 13th, at the latest the 18th. So those restrictions will be open almost at least a minimum of 2 weeks prior to March Madness, the bars, the restaurants, and the other venues.
I'd simply add to that, Amelia, that Dr. Caine's right. I think the first game games, I should say, for the Division I men's basketball March Madness tournament of the NCAA will be on or about the 18th of March. Whether or not there are subsequent public health updates that Dr. Caine and I provide between now and then, that's largely up to Dr. Caine, the science and the data. We always remain open to doing what is in the long-term best interest of not only the people of the city of Indianapolis, to our visitors, but also the health and safety of our restaurants and other hospitality institutions. I follow Dr. Caine's lead in this regard. If there would be changes between today, the 25th of February, and the 18th of March, certainly we'll try to provide as many health updates as we can. But that would be up to the science and the data that Dr. Caine and her staff at the Marion County Department of Public Health would be interpreting at the time.
All right. Thanks, Mayor. Thank you, Dr. Caine. Thank you, everybody, for tuning in.